My name is Chief Asuko Asibong is my name. I'm from Nigeria. My age is 52 years old. I'm a businessman and a politician in Nigeria. How I came to know about the Marx specialist was when I called a friend, Charles Kennedy, said, "Charles, I'm coming for treatment in India." He said he has the best hospital in India, that I have a problem that took me to India, and the problem was that I have a swollen leg, blood pressure, I was hypertensive, I had a heart disease, so I was diabetic and obesity. So for that reason, I decided to come to Marx Specialty International Hospital. When I came, I met the staff of the hospital. They are very kind, very hospitality, very nice, and I met with Dr. Nikki after the whole test that was done, so it was fine. At the end of the day, I met Dr. Nickel for the last time for the surgery, and the surgery took place successfully. It was very good, and I came out from the surgery, and I'm now very strong, and I am now back to my feet. I have not been eating after the surgery up till now. I have not been eating, and I'm still very strong. So I would like to encourage people to patronize and come to Marx Specialty International Hospital in India to see how they can solve their problems in the heart disease that has been so common in the world. I am saying that the hospital is hospitality for everybody. So that's what I have to say for now.
So we have Mr. Asuko Asibo, who is a 52-year-old male. He visited us basically with multiple problems related to obesity, such as diabetes, hypertension, joint pains, and also swelling in his legs. So he was on various medications for all these ailments, and he was very short on breath with exercise, listening on exertion. First, actually we did a complete workup for him. We asked him to come visit us for a day. So whole day we ran the blood tests, consulted various cardiologists, chest physician. So after taking a complete note of the whole situation, we planned the surgery a day after that. So we admitted him the previous day. He underwent a laparoscopic sleeve gastrectomy, and it was a short 2-hour procedure. His pre-operative weight was 180 kgs before the surgery. And after the procedure, we usually observe the patient for a night in ICU, and the next day we do a gastrographin study and shift the patient to the ward. So basically, post-operatively he's been fine, he's been doing well. He's already feeling a touch better as far as his breathlessness and joint pains are concerned. Obviously diabetes is controlled now, he's off treatment, not requiring any insulin, and hypertension would be taken care of in the coming months. So I think he should be doing really well after this. So we usually observe these patients post-operatively for a period of 2 to 3 days till their oral intake is adequate enough and we are comfortable discharging them home. And he will be put on supplements, though he will not require, probably he will not require any medicines for diabetes He might require some management of hypertension for a few more months till he loses significant weight. And first, again, obstructive sleep apnea and breathlessness is the first to go as you lose weight from your neck region. And he will be on supplements for a period of about 1 year after the surgery. And we usually follow up our patients at 3 months, 6 months and 1 year with all the blood tests, because we will be prescribing iron, calcium and multivitamins. And but in his case, if he can come to India once, we'll be happy. Otherwise, we would keep a track of him through the email.
My name is Mrs. Asibon. My husband was not feeling fine before we came to India. Was having hypertensive, diabetes, swelling of legs, and in the respiratory problem in the night, too much of snoring. But since when we came to India and after the treatments, he's now feeling okay. He's no more snoring. The ankle pain leg has gone. He's no more feeling pains in his legs. He's now moving his leg freely.
Yes, sir.
Now I'm so happy to see him. He feels so light. He can now walk freely without complaining of pains, without sitting on the road. He is now very, very okay. I am very, very happy. The hospital is good, the management, the nurses, the doctors. Dr. Nikhil has been so wonderful. He's always there. And he sees my husband gets better and is better. So I'm so happy.